Hello everyone, welcome to another episode of TooHealthTalk, a show where we talk about real health challenges in a very honest and simple conversation. On today's episode, we have a special guest with us, Dr. Aminu, a family physician. Welcome, Doctor.
Nice to have me.
Thank you. You're
Thank you, sir.
welcome. Yeah. So today's topic is a very controversial one. It's a topic that gets affect mainly people that are married or people that want to get married and want to have some want to live their life in some certain ways. So we're talking about vasectomy. So there's been a lot of like controversial talk about vasectomy. That should men do vasectomy? Like why is it that it's only based on women? Like family planning is only based on women. That's why we're able to get a family medicine physician to give more insights on vasectomy if there is any harmful or if there's anything that can harm someone. So I just want to give us a brief explanation of what vasectomy is.
Okay, thank you so much for having me. As I said, or as you introduced me, I'm just a family physician, and it's interesting that you brought this topic.
Yeah.
Uh, it's very thoughtful of you to bring this topic to enlighten the public, especially the male and even the female partners on this very important topic. Vasectomy, as it's a medical terminology for a surgical procedure where males undergo a contraception, but this time it's not the kind of contraception or kind of birth control that is like that of the ladies that they take medication. This one is a way in which, if it is done, is called male sterilization. Just to put it in a simpler way, male sterilization, you sterilize the man, and he will no longer be able to impregnate a woman. Simple as that.
Oh.
And it's done through some surgical procedures.
So is it true that this procedure gets to reduce men performance in bed, like sexual performance?
No, it's not true.
Or
Because what it does only is that it's uh, cut off the medium, that's the transport medium of the sperm that fertilizes the egg from the testicles to the urethra to the penis, where if a man ejaculates, it goes into the woman. That's the only thing that vasectomy does. So it does not have anything to do with the libido or any other thing about his performance. His performance is still there, his testosterone is there, all the hormones that he produces are still there. He still has erection, and he still even ejaculates, but he can ejaculate without the men's semen, sperm that fertilizes the egg. That is the only difference.
so is this procedure is it a permanent procedure or like can it be reversible?
Yes, I can say yes. It can be permanent, but it can be reversible. But it takes a very good surgeon to be able to reverse, because it's a procedure where the tube that transport the semen is either cut completely or ligated. They can ligate it. If it's a ligation, well, of course, that one can be reversed if you remove whatever you use in tying the tube. But if it is cutting, real vasectomy by surgical procedure, then that one will take a little difficulty, unless you have a very good expert that can join the tube that has been cut already. If
Wow.
not, and it takes about, from the time that he did, to about 10 years. If you
Wow.
want to reverse it, you can reverse it within that 10 years. But after 10 years, it's going to be difficult for the reversal to be successful if you want to reverse it at all.
Wow.
Yeah.
So Do you advise this? Do you advise vasectomy for men?
Well, I won't say I would advise me to do it. It depends on either it's a kind of personal decision, or I can say a decision between the man and his spouse, female, But if he actually wants, he has completed his family, he's completed the number of children he wants, and he no longer wants to impregnate a woman. Of course, he can do vasectomy. That's the very simplest way of doing it, and it's cost effective, and it's devoid of all the other side effects of medications and other sign of side effects of either putting the barrier method of doing all things, and then mistakes. There'll be no mistake. Once he has severed has vast deference, no more semen will be transported, and he cannot impregnate a woman any longer.
Oh, so now with this stuff that you've explained, now you explain that, oh, okay, so vasectomy in the whole aspect of like family planning, vasectomy is the safest.
It's the safest.
Wow.
It's the safest as far as I'm concerned. If somebody has completed his family and he no longer wants to impregnate, or he does no longer want to produce children, it's very safe.
Oh.
It's very, very safe.
But if medically they're saying it's safe, then why is it that like more men don't go into like vasectomy? Because I'm thinking about it in the sense that, if it's safest, we shouldn't be stressing ladies to do to take pills, to go through so much pain just to like do family planning. Because in Africa in general, family planning is only like focused daily on like women. Nobody talks about men doing family planning. So every of the like coming up with pills, taking injections, only based like in women. So I don't know if it's because of like Africa in general, or saying that, oh, if a man gets to do vasectomy, the man has lost his masculinity, his manhood in general, is being a man.
Sure.
So like once you do vasectomy, you're no longer a man.
Sure. It's part of what is not as popular as the other forms of contraception, and of course, as you said, is because of the myth and the misconception that's attached to vasectomy. People are not much aware of how safe it is and how easy it is, and that it has no much complication because they are afraid. That's one. The second one is, of course, the myth that's involved. They will say you're going to lose your masculinity, you're going to lose your manhood, you cannot be able to impregnate somebody or your wife, things like that. These are the myths, and the misconception is probably they will think, okay, this cannot be reversed. If I want to have child again, it can be reversed. Another one is, okay, maybe I will have a problem will happen to me, things like that. So that's one of the myths, the misconception. If not, it's a very simple and it's a safe way of sterilizing the man, and of course a contraception. Um, the second one is, I think there is no much enlightenment out there for men to know that another way of making sure you have finished, you completed your family, and no longer you will not make mistake. For example, no mistake of impregnate your wife, or no mistake of maybe doing something outside. Is the best thing is vasectomy. And so men can, if they are enlightened about it, how it is done, how safe it is, how simple it is, and then how surgically proof, there is a proof that if it's done and well done, you are going to be permanently sterilized. You're not going to be able to impregnate your wife, but you'll be able to perform the sexual intercourse. You'll be able to perform your male kind of performance, satisfy your wife. You can do that. The only thing is that she will not be pregnant.
Okay, nice one. I think I've gotten a lot of insights just discussing this with you. I've gotten a lot of insight on how vasectomy works, and I just hope they get to like raise more
Awareness,
awareness
of
on
course.
vasectomy. I'm not going to say I'm going to do vasectomy because
Yes.
I don't know, but I know that raising more awareness so that people are able to come together and decide, okay, are we going this way? Are we going to the left or are we going to the right? Okay, we would like to take the responsibility of doing the family planning down, or should I allow my wife to do family planning? Because this thing still boils down to the woman that are you going to take the responsibility of taking that burden from her and save her the stress of taking pills every month or stuff like that. So
Yeah.
at this point we've come to the end of this discussion.
Yeah, I want to chip in one or two things
Oh,
by
okay.
saying that yes, vasectomy is one of the procedures that is safe for men and is another alternative where you can actually plan your family. While I will not advise young men to go into it because nobody can tell whether in the near future they won't have children again. And as I said, if you do vasectomy within the time you did it to about 10 years, you can reverse it. But after 10 years, it has healed. It's difficult to reverse it. Everything has healed, and the place might not. It's not easy for surgeons to reconnect the already cut off tube. So young men and women should think twice about vasectomy, but they also should discuss with their partners. They have to discuss it. It has to be a collective responsibility, collective decision. If they decide yes, they've gotten the number of children they want, and they want a permanent uh, cessation of pregnancy, the man will take it up as a man. It is a man that will do the decision actually. It is not easy, but if the man decides that yes, he does not want to have the issue of children again or making mistake of impregnating his wife again, he can do vasectomy, which is good. And then within 10 years, if he wants to change his mind, he can go back to the surgeon again and reconnect.
So you're advising now that men should take the responsibility of family planning. Like men should
Yes.
take the bold step
They
of that.
should men should be the one actually to be in the forefront of the family planning because there is a man who actually impregnates the woman. It is not the woman, it's not the other way. It's a man that actually gives the seed that fertilizes the egg. Without the man's seed, the woman cannot be fertilized unless if it is through IVF or other means.
I'm not sure some men will take
So men should be the one to take bold step to come forward to say, okay, fine. Instead of me to advise my wife to be taking injections or taking tablets or taking all these chemicals and what have you, some of them fail. Some of them have side effects. The side effects are there, but the side effect of vasectomy is very, very small, very small. During the surgery, after the surgery, within 2 weeks, you are well and go. You can even start working within 1 week. You can go to work, like that. So and you'll be fine. Within 1 month, you are okay. You will no longer be able to fertilize any egg. You cannot impregnate your wife. So vasectomy is the best, one of the best contraception. If men can come forward to do that, that will save the challenges of family planning in couples. So couples will be able to plan their children, and the wife will be happy that at least it's not me that is taking the drugs or
yeah.
is taking the jab or putting the female condom or taking the burden of trying to space children and what have you. So vasectomy is a very good idea if male will be bold to decide because it has to be a decision by the man and then the woman will also accept. So collectively if they agree, that is the best way to go.
Oh, thank you so much, doctor. I hope more men get to listen.
Well, I hope so. I'm not saying that they should go all out for that, but I think the safest way, as far as I'm concerned, is vasectomy. Is vasectomy. If you compare all the other method of contraception, be it barrier method, putting condom, male or female condom, or tablets, uh, or injectables, all this. or even the woman putting IUCD in her body, there are complications. And then, or she also do bilateral tubal ligation, because the way she does that ligation, that's how you do the vasectomy, because it's similar to the what they do for her in her tummy. They go in and severe her tube or tie the tube. Then if she wants to have babies, they have to go back again and try to reconnect or remove if it's a band that they put there, they have to remove the band.
Oh,
Yeah.
okay.
So vasectomy is a good alternative. But the man has to be the one to take the bold step this time around.
Man, take the bold step.
Yes.
Okay, thank you very much for coming on the show, Doctor.
Thank you for having me.
Yeah, so please, if you want to support what we're doing here, please like, share, and subscribe. And thank you for watching up to this moment. Bye.